surgery is more often than not difficult, more so for major surgeries. It is even harder when you are the first ever patient to undergo that major surgery in a hospital not previously known to do such surgeries. Now, picture this. You have to make that decision not once, but twice. 70-year-old Rael Mwau had been experiencing excruciating knee pains for 4 years prior to getting any help.
Hii miguu inaanza 0:15.
Arthritis, which becomes more common as one ages, was catching up with her and disrupting her life the way she knew it. Like the story is with everyone with a chronic illness, Rael had traversed the counties of Makueni and Machakos in search of treatment. She had visited several hospitals and all she got was medicine to ease the pain. This, as expected, did not address the underlying issue. That her joints had been worn out over time and what cushions the two main bones forming the knee joint was no more. Julius Kivala is one of Rael's sons. He works as an anesthetist in Makueni County. His mother's pain had also caused him heartache.
Mama amekuwa na shida ya kuuma na magoti. So this is a problem amekuwa nayo kwa muda. Na ikakuwa wakati natoka kazi nikikuja pande nyumbani anakuja ananiambia miguu inauma. That is how it all started. Kwamba tu miguu inauma. Then kwa sababu mimi ni daktari naangalia naona na realize hii miguu kwa magoti zimefura. Then I realized this could be arthritis. So nikamuita siku moja akakuja Makindu. Initially before ifike time ya operation nikamuita kule. Akakuja tukamwangalia na daktari mwingine rafiki yangu aitwa Dr. Gatura. So tukaangalia realize kwamba kuna arthritis na ni kwamba ni kama imekuwa kwa muda. Sababu pia ukiangalia miaka yake na hiyo ugonjwa zinaenda pamoja. So we managed to give her some injections just to make sure that we arrest the inflammation, the joints, ndio iache wear out the cartilages. So this is something to be repeated kwa muda. Until now, I came to realize it's not working. Then one time I came home, then as she was walking, nika realize amekuwa na kind of knocked knees. So I realized now this thing is getting out of hand. So I called my brothers, my sisters, and then we talked about this. Then we decided something has to be done.
It was obvious that Rael needed to have a knee replacement surgery. At the time, getting such major surgery was a preserve of the big cities like Nairobi, and the cost involved was prohibitive. But luck was on their side.
That particular time, we had a new doctor who had already been posted to Makindu, and the guy is an orthopedic surgeon, Dr. Mwoki, James Mwoki. So nikaenda nikaongea naye na kwa sababu tulikuwa tunafanya kazi naye theater pale tumezoeana, nikaongea naye then akaniambia this thing is possible, we can do it as a team. Then we called in the third person akakuja and then we agreed we do the knee replacement. Sasa ikabaki shida ya kuja kuelezea mama, na unajua this elderly people umuelezea mambo ya theater unaweza kwa sana. So we go slowly. So nikakuja nikawaelezea wenzangu na nikamwelezea mama, nikamwambia now lazima replace hii knee joint, lazima hii goti tuitengeze, maana yake sasa ukitembea hivyo na wewe ndio kila kitu nyumbani hapo itakuwa sio nzuri. So nikangana naye akakubali, and then we looked for the money, and then after tumemanage kupata chuma, we went in theater.
This would be the first ever knee replacement surgery for Makueni County, carried out at Makindu Hospital. Dr. James Mwoki had done many such previous surgeries while in Nairobi. For him, this would be a surgery like any other, except the anxiety of these being one for the history books. On 2nd July 2019, Rael underwent the first knee replacement surgery where the worn-out parts of the knee are replaced with a metallic implant designed to mimic the knee.
We went in, we did the operation, and it was very successful. Initially, there's a bit of pain after kutoka theater, because you can imagine it's involving the femur and the tibia. So those are big bones. So it's like chopping off, then putting the implant inside there. So, and then, kuna bone cement. The bone cement sometimes creates a bit of pain and a discomfort. So akakuwa pale hospitali for like a week or two. It was around 1.5 weeks. Then pale alikuwa anafanyishwa physiotherapy. Kidogo kidogo mguu unakunjwa. Unajua that time because of the incision na hiyo bone cement mguu lazima ufure kidogo. So we did some physiotherapy and she came up. By the time she was leaving the hospital, she was walking. It was amazing. And then because she was on strong painkillers, she was a bit comfortable. Then when we came home, and then I went back to my workplace. So after a week, I came back. I realized she was doing very well. She was walking around. She was not using any walking aid. So it was amazing. It's something that I would actually recommend for people with such infections to go ahead to do that.
Rael, who had become dependent on a walking aid, was literally back on her feet, but not entirely. She was still struggling, though not as much as before.
Why we did the second day, it's because a month later, she realized now this leg, the limb that we've done the transplant, is the one which is now working, is the one which is carrying the body. So we feared now the other one, because the other one is bent. So it was, when she's walking, it is touching the other knee. So we said, now if this one can be like the other one you corrected, then I think it would be a good thing. It should be okay and working very well and very comfortable, no pain. Once you replace the knee joint, it's nothing like arthritis again there. Yeah. So we talked again. We regrouped, and then we went back for surgery again. We did the same thing. She refused to be given anything by anybody else. I did it, and well, she came out of theater. She was very okay. She stayed in the ward a bit. That time she stayed for like 2 weeks, because there was a bit of pain, and then she was worried, after going and undergoing the first pain in the first knee. So she thought she needed some time to be there, some physio kidogo. And then within 2 weeks, she was okay. She left the hospital with a walking aid.
Having 2 knee surgeries in a span of 2 months was commendable, both for the surgical team and Rael for taking the risk that more often than not many shy away from, for fear of complications or simply the fear of the unknown about joint replacement surgeries.
We brought her home, and I thank God she's very okay. After like a week from the hospital, from the last operation, she was not using anything.
How is she now?
She's very okay. She's walking. I would say she's walking like under 16 now. I'm so happy.
Naendelea vizuri.
Unaweza kufanya kazi zako gani? Unalala usiku?
Kabisa. Vizuri sana.
Hapo mbeleni?
Sikuwa nimechikia uchungu kabisa.
I think it's just something that I will, just to recommend anybody who has, okay, it's an expensive endeavor, lakini it's something that is doable. It's being done in Makueni. So, and we are not restricting another county or another patient from other quarters. We've been receiving calls from Nyeri, from Nakuru, from all other places. So it's something that we can do. We are not charging anything extra. The tumor does not belong to us. So it's the company. So as you come, you pay theater. If you belong in Makueni, you don't pay the theater, because there is that, the universal healthcare card. So if you're in Makueni, it's free. So you only need to get the tumor.
Makindu Trauma Center in Makindu County Hospital began responding to people like Rael Mwao and others with trauma and other orthopedic cases that would need the attention of an orthopedic and trauma surgeon. The Nairobi-Mombasa highway is a major artery that connects the two cities, and none can exist without the other. But this major stretch of tarmac has claimed lives, maimed others, and scarred some, both physically and emotionally. All this due to the unavailability of ideal trauma care along this road. Makindu Sub-County Hospital has always been the first call for rescue. Prior to the center being set up, many would have to either live in pain or go through a lot of challenges to access a specialist and a facility with the necessary equipment for an ideal and safe orthopedic surgery.
In view of all these trauma cases, all these accidents, mainly the highway, so it was, Makindu is a central point. Yeah, and it's in the center of most of the counties on the highway. So really it was decided that this trauma center is important. And that is based on the previous cases that were being brought to Makindu, and then the hospital didn't have capacity to handle such cases. So I think it was paramount that we set up the trauma center.
According to the National Transport and Safety Authority, NTSA, the number of passengers who have lost their lives on the road has reduced compared to the same period in 2019. 156 passengers had died by April 13th, compared to 205 in the same period in 2019. 367 pedestrians have lost their lives since the year began, compared to 348 in 2019. The restrictions in movement due to the ongoing coronavirus pandemic partly explains the reduced numbers in passenger deaths. The Makindu Trauma Center, which has come in handy, is a relief for many other Kenyans besides the residents of Makueni County.
The catchment area is very wide. First of all, I get referrals from the entire Makueni County. I get referrals from as far as Loitoktok. I get referrals from Taita Taveta. I've seen referrals coming as far as Maungu, Mariakani. Really, you see a lot of patients. I don't know how they get to know about Makindu, but I see so many of them from faraway areas. Yeah. Most of the cases we deal with in Makindu are trauma cases. And usually the causes are road traffic accidents. We have many road traffic accidents in this area. This area being right on the Nairobi-Mombasa highway, we get a lot of road traffic accidents with very bad injuries, and they're very frequent. The other cause is motorcycle accidents. This again being a rural area, there are so many motorcycles, and we see a lot of accidents, again with bad fractures caused by motorcycle accidents. Another situation I've noted is there are many animal attacks also around this area. I've seen attacks from crocodiles, hippopotamus, elephants, and I think it's because of its location. It's near parks, like Chulu National Park is just across the road. Savo West, Savo East, it's situated, it's an area that has many national parks around, and even the Athi River that has many animals also traverses the region. Yeah. The other one maybe is, again, this being a rural area, there are many elderly people. So the elderly population, again, is prone to low energy fractures, and we see so many of them.
Dr. Mwoki and team have to attend to everyone with trauma. Their work is not limited to fixing broken bones and painful joints.
Really, in terms of trauma here, we're able to do, we're actually able to do most of the things, including surgery. We are able to do most of the emergency surgeries, be it emergency laparotomies, be it any orthopedic surgery. Even we do some evacuations of intracranial hematomas. However, it's really challenging for cases that require ICU admission, since we don't have a running ICU at present.
You don't have to.
In orthopedics, we are able to, in terms of trauma, we are able to sort out most of the long bone fractures. Let's just say most of the lower limb and upper limb fractures. Maybe the only challenging area is the spine. The spine, you're not able to do it here. Yeah, maybe because of availability of the equipment that we require.
The challenges with orthopedic surgery for many is the cost of the implants that are needed in fixing fractures and joints. At times, one has to raise funds from friends and relatives to buy the implants to be used in the surgeries.
Fixing bones depends on the site of the fracture. We have an array of implants that we use. We have interlocking nails for long bones. We have either distal or proximal locking plates. Really, depending on where the fracture is. We have what we call K-wires that we commonly use for pediatric populations. And then sometimes we just have screws. There's some injuries that we just need purely screws. Yeah, among others. There are quite a number of implants. Right now, most patients actually do not pay anything if they are registered with the Universal Healthcare for Makueni County. The services are completely catered for. Again, those patients with NHIF also, the facilities are completely catered for. But for those patients without UHC and without NHIF, then they have to dig into their pockets and buy the implant. On average, an implant will cost about 25,000. Yeah, then there's theatre fee and the ward charges that apply.
Costs aside, a stay in hospital can be a distressing time for the sick, the family and relatives.
On average, let me talk about those emergency surgeries, or rather the surgeries that are not planned, like a patient has just been injured today. Because of the numbers, on average, patients will take about a week to 2 weeks in the ward. Yeah, and in about 2 weeks, they will have been sorted and discharged home. It is difficult because of the numbers. Probably if there was someone else, we would reduce the turnaround time to about a week. Previously, we used to use other methods of treatment, such as tractions. Traction on average takes about 2 months in the ward. Yeah, and really, if you compare 2 months to 2 weeks, that's really some amount of resources saved.
A shorter stay is often desired, and for orthopedic cases, depending on the treatment done, one can proceed to continue recovery at home as they keep up with their clinic appointments for follow-up.
Trauma is challenging in that we're not looking at trauma in terms of orthopedics alone, but the entire person. Yeah, and sometimes some cases are fatal even before they get to the hospital. Others are very bad head injuries, very bad chest injuries. I will be happy, if we had a complete trauma team that even involved a neurosurgeon, cardiothoracic surgeon, and that way, I think it will be more efficient.
Dr. Mercy Korir, KTN News.